Hello there, my name is Sunny and I'm the Educational Fellow for the Leicester Royal Infirmary Emergency Department. This video is a cross-specialty adult trauma video designed to show the processes involved in receiving an adult trauma call to the emergency room. We have recorded the patient's journey from the pre-hospital call from paramedics through to patient arrival, stabilisation and safe transfer to CT scanner. This video has a few key objectives we would like everyone to look out for. The first objective: wearing AGP level PPE has a large impact on effective communication. Look out for the use of communication aids such as whiteboards and hand gestures that can help with this. The second objective: how to clearly allocate roles within a large team. In our department, we have trauma stickers that we use to identify staff members more easily. The third objective: how to access the emergency room safely. Many staff will be new to the department or this hospital. This video captures the journey of specialties coming to the emergency department and some updated COVID-19 donning and doffing procedures. We begin the video with a pre-alert call to the emergency room answered by the nurse coordinator. She's informed of an 86-year-old male who's fallen down a full flight of stairs about an hour ago. The ambulance crew are concerned that the patient has sustained a chest wall and right hip injury and is unstable with a low blood pressure. The patient is 5 minutes away from the emergency department. The nurse coordinator relays this information to the consultant and registrar in the emergency room. She then puts out an adult trauma call by calling our emergency switchboard number 2222. For ease of use, we have used the phone on speakerphone. The senior anaesthetic registrar is alerted by his bleep. Meanwhile, in the emergency room, the consultant has taken on the role of team leader. All team members are using stickers to help identify each other and their respective roles. The team leader is using a mini whiteboard to allocate tasks to his colleagues. The registrar is summarising key points from the pre-alert sheet on the large whiteboard for all team members to refer to. The nursing staff are fetching all relevant equipment and paperwork prior to patient arrival. At this point in the journey, the senior anaesthetic registrar is making his way to the donning and doffing porter cabin located outside the emergency room. In the porter cabin, he is greeted by a healthcare assistant who helps him safely don. The registrar and the operating department practitioner then make their way to the emergency room. They approach the team leader and introduce themselves using mini whiteboards. They are then provided with trauma stickers for clear identification. You may notice that the stickers are being placed on the upper arm. This is to prevent them being covered by aprons that will be worn later. The same process occurs with other specialties inclusive of general surgery and orthopaedics. The surgical registrar records her name and time of arrival on the back of the trauma booklet. All members of the trauma team will document these details when they arrive. Now that all members of the trauma team are present, the team leader refers to the summary on the large whiteboard to ensure that everyone is aware of the pre-alert information. He then confirms roles and relevant tasks with the use of his mini whiteboard and hand gestures to help with communication whilst wearing a respirator. Team members are putting on aprons and gloves in preparation for the patient's arrival. These are located in trolleys situated outside the bay. Once the patient arrives, the team members begin their assessment and relevant tasks. The orthopaedic consultant uses a mini whiteboard to communicate clinical findings to the team leader. He closes the communication loop with a thumbs up to indicate that he has acknowledged this. The anaesthetic registrar has identified that the patient is very unwell and that he will need additional support from his consultant. He communicates this to the operating department practitioner and team leader. The team leader tasks the emergency registrar with making the urgent phone call to the anaesthetic consultant. She arrives promptly and introduces herself to the team leader. Approximately 15 minutes later, the patient has been stabilised and is ready for transfer to the CT scanner. The team leader coordinates this and ensures that the radiographers are ready for patient arrival. The team members refer to the ER transfer checklist to ensure that all safety measures have been addressed prior to departure from the emergency room. We hope that this video has successfully summarised the processes involved in receiving an adult trauma call to the emergency room. For any further information, please feel free to contact the Emergency Department Education team. We look forward to working with you all soon.